Hey guys, it's Piper. Thanks for being here and welcome to Autopsy Reports. Stay till the end for a look inside the Autopsy Reports Knowledge Bank. And if you like this kind of content, consider subscribing. All right, let's get started. So here's the backstory. Suzanne Morphew was a beloved mother of two daughters, a sister, a daughter, friend, and wife of her high school sweetheart, Barry Morphew. Suzanne was born and raised in Indiana until giving in to Barry's wishes to move to the Salida area in Colorado, Maysville to be more specific. Not too long after, the issues in their marriage became undeniable, and on May 6th, 2020, Suzanne sent a text to Barry saying she was done with the relationship. May 9th, 2020 was her last proof of life from a selfie she sent before Barry reported her missing on May 10, 2020, Mother's Day. He stated she had left for a bike ride and never returned. May 5th, 2021, Barry Morphew was arrested and charged with the murder of his wife. But nearly a year later, on April 19, 2022, among controversy, a judge dismissed the case against Barry and he was released from custody. In September of 2023, the weathered and decayed remains of Suzanne Morphew were found near the town of Moffat, Colorado, which is approximately 90 minutes from their marital home. Then again, on June 20, 2025, just this week, Barry Morphew was indicted on the charge of the premeditated murder of Suzanne Morphew, this time by a grand jury. He was arrested in Gilbert, Arizona, and is awaiting extradition to Saguache County, Colorado. Today, we will review the autopsy report of Suzanne Morphew. Okay, so here it is. El Paso County Coroner, East Las Vegas Street, Colorado Springs, Colorado. Name, Morphew, Suzanne. County, Chaffee. Date of birth, April 30th, 1971. Age, 52 years. Sex, female. Autopsy number 23-1011. Autopsy date, 9/27/2023, beginning at 10:30 a.m. MD Emily Russell Kinsley. Date of pronouncement, which means pronouncement of death, September 22nd, 2023, which is the date that her remains were discovered. Time of pronouncement of death, 3 p.m. Identified by dental records and DNA. And we'll scroll down. Final diagnosis: homicide by unspecified means in the setting of butorphanol, azeparone, and medetomidine intoxication. And we'll discuss those three drugs further in a moment. Bullet A: reported history of recovery of a partial skeleton, medical port, and clothing scattered in and around a shallow grave in Saguache County. Positive dental identification at time of autopsy examination. So that means the way that they initially identified Suzanne was through comparison of her the teeth that were found with the remains and her pre-existing dental records, comparing those to see if it's the same person. Bullet C: reported history: decedent was reported missing in Chaffee County on May 10, 2020, and her bicycle and helmet were discovered without significant damage in separate locations within the county. D: no indication of perimortem trauma. See forensic anthropology report. Perimortem trauma means trauma to the body that happens either immediately preceding death or immediately after death. And because it's so close to the time of death, so it's difficult to determine if it was done before or after. So they call it perimortem, meaning around the time of death. Postmortem toxicology of femoral trabecular bone identified, again with the medications, butorphanol metabolites, azeparone, and medetomidine. See toxicology reports. So let's look at this. First of all, just to orient everyone, this is Saguache County where the remains were found. This is Chaffee County where Suzanne lived. In the bone, long bones like the femur, which is the leg bone, there are three different sections: the epiphysis, metaphysis, and the diaphysis. Sometimes you'll hear of the epiphyseal plate. That's the growth plate between the bones. That's more prominent, or it's visible in younger children and calcifies over time and with age. The metaphysis is just here at the neck. So it's under these balls, but not in the long bone part of the actual bone. It's here in the neck. And the thing about the metaphysis is that it has a variety of types of cells in it. So there are hemopoietic stem cells, there's, blood cell precursors, and different types of cells that can be really useful if there are things that you're looking to identify from the bones, such as DNA. And they mentioned in the autopsy report on the first page that we've gotten to so far that the samples were taken from the trabecular part of the bone. The trabecula is this spongy area in the bone, usually in long bones or in larger bones. And on the outside, you see this denser area. That's the cortical portion of the bone. So when they say trabecula, you know that they're talking about the spongy area where you know what looks more like what you would think bone marrow would look like. And here is the information that we have on the medications that were found in toxicology. And don't worry, we will get back to the autopsy report. But since these things were discussed on page 1, I want to review them. And this is a lot, so bear with me. But this is what AI says about these 3 drugs, butorphanol, zeparone, and metomidine. It says this combination of drugs, often referred to by the acronym BAM, is a widely used drug combination, especially in veterinary medicine, for purposes such as wildlife capture and immobilization. BAM is frequently employed to safely capture and handle various animal species, including elk, deer, cheetahs, and black bears. Chemical immobilization. BAM is used. What chemical immobilization means paralyzation of someone or a creature, an animal, by use of a chemical, of medications. BAM is used to induce a state of chemical immobilization in animals. It makes it so they can't move. Doesn't make them go to sleep. It just makes it so they can't move, allowing for safe handling during procedures or transport. Veterinary anesthesia and sedation is another use. BAM can be used to provide anesthesia and sedation for various procedures. Here's a breakdown of each drug's role in the BAM combination. So the first drug, butorphanol. This is a synthetic opioid with properties that include, and so this is where you would get some sedation, but it's not something that's going to put you under like an anesthesia would, okay? So sedation, it helps to calm and relax the animal. Analgesia, which is pain relief. Tylenol is an analgesic medication. Butorphanol offers pain relieving effects. Antitussive, which means anti-coughing, and antiemetic, which means it helps you to not throw up. It can help suppress cough and prevent vomiting. DEA Schedule 4 opioid. Butorphanol is classified as a Schedule 4 opioid analgesic, which means it has a lower potential for abuse than Schedule 2 opioid. The next drug, azeparone. This is a tranquilizer that primarily acts to depress the nervous system. It helps reduce motor activity, which means, movement of the body or voluntary muscles, and induce a state of tranquility. And that is more of a, it depresses the nervous system, kind of like, some drugs do that might make you real tranquil, like a Xanax or something like that. A benzodiazepine kind of. This is not a drug like that, but I'm saying it's that type of effect. Antiemetic properties may help prevent vomiting. The metomidine. This is a potent alpha-2 adrenergic agonist with characteristics including sedation. It provides powerful sedative effects and can produce recumbency, which means you lose the ability to stand up. So it can induce, you immediately just falling down, losing the ability to stay upright. Analgesia, it provides pain relief. Muscle relaxation can help relax the animal's muscles. Anxiolytic properties, it can help reduce, which means it can help reduce anxiety. It potentiates butorphanol. So potentiate means that it works with something else, and together they enhance the effects. Oh, okay. So I don't know why I keep describing, and then it describes it for us. Metomidine enhances the effects of butorphanol, allowing for reduced injection volume. So together, you can use less of both. Advantages of using the BAM combination. So we've gone over the individual drugs, and now using it as combination, small injection volumes. The combination of the 3 drugs allows for a smaller volume of drugs to be administered. Anti-emesis, it can help prevent vomiting. Smooth induction and recovery. The onset and reversal of the drug effects are generally smooth, meaning they're not abrupt, which I don't know about that, because it's a pretty abrupt onset. Reversibility. The effects of BAM can be reversed with specific antidotes such as naltrexone, which is Narcan, and atipamezole. I don't know that drug, but obviously it's a reversal agent that works with this combination of medications. Muscle relaxation, it provides good muscle relaxation. Lack of ptyalism, which means it doesn't cause excessive salivation. So far we're seeing that it's a good combination as far as preventing body secretions like salivation and vomiting. Potential side effects of BAM. Cardiopulmonary side effects. BAM can have effects on the heart and lungs, including hypoxemia, which means low oxygen levels, and bradycardia, which means a slow heart rate. Cyanosis, which means bluish discoloration of the skin. Bradyapnea, which means slowed breathing, which means less than 12 breaths per minute, technically. And slow heart rate, bradycardia, is defined as less than 50 heartbeats per minute. Another potential side effect is muscle tremors, which is rare. Mild twitching and muscle tremors, though, can occur. Elevated blood pressure. In some species, such as lions, elevated blood pressure has been observed. In summary, BAM is a combination of butorphanol, azeparone, and metomidine that offers effective immobilization and anesthesia, with advantages like reversibility and small injection volumes, while also requiring careful monitoring for potential side effects, particularly cardiopulmonary effects. I do know that my understanding is that Barry, I think it was in the press conference today or on a local station in Colorado, a news report, one of the two. And they stated that the only person in Colorado known to officials to have this BAM medication in their possession is Barry Morphew. And I do know, we've known for a while now that he used this combination of drugs to sedate and transport deer on his deer farm. Okay. So just to kind of review, we reviewed that the trabecular bone, the spongy bone, and the long bone of the leg. We showed you that, and the medication. And then she had a clinical history. Decedent was receiving maintenance rituximab chemotherapy after complete remission of recurrent follicular lymphoma. Rituxan or rituximab is a monoclonal therapy. It's not actually a chemotherapy, it's an immune therapy. It's a monoclonal antibody therapy. And it's a medication that's given on a recurrent basis, like depending on the regimen they're doing, it could be or, um, but it's infused. You don't have side effects like you don't lose your hair and get nauseated and all of that, but it's given after the person is in remission from their lymphoma. And this is called like a maintenance therapy to try to keep them in remission for as long as possible or forever. So she was on Rituxan therapy for that. Opinion. Based upon the information provided to me at the time of this report, it is my opinion that Suzanne Morphew, a 52-year-old adult white female, died as a result of homicide by unspecified means in the setting of butorphanol, azeparone, and medetomidine intoxication. These drugs are marketed as a compound injectable chemical immobilizer for wildlife, providing pharmacologically reversible analgesia, sedation, and immobilization. If more information becomes available, this report may be amended. Manner of death, homicide. Signed, Emily Russell Kinsley, MD, Leon Kelly, MD, Allison Cooper, MD, Megan Kleisner, MD, Jared Murdoch, DO. And then it looks like it was transcribed April 15th, 2024. Persons present at autopsy. Robin Burgess and Alex Walker of the Chaffee County Sheriff's Office. Daniel Garcia, Tanya Atkinson, and Jody Wright of the Colorado Bureau of Investigation. Ken Harris of the Federal Bureau of Investigation. Carlo Barrios of the Saguache County Sheriff's Office. Sam Kaufman of the 12th Judicial District Attorney's Office, and Chaffee County Coroner Jeff Graff are present during the post-mortem examination. Forensic odontologist Kim Look, DDS, Doctor of Dental Science, DABFO, which just is probably abbreviations like a fellow of odontologist, some sort of professional organization, is present during autopsy examination to perform dental identification. General examination. The decedent is initially identified as Jane Doe. Submitted for examination are 3 large paper bags containing bones, 7 brown paper bags containing clothing, and 7 envelopes containing items to be described. The submitted items are radiographed, meaning they were x-rayed. External examination. The skeletal remains are submitted in 3 bags labeled Jane Doe R and 17 Saguache County, Day 1. Jane Doe R and 17 Saguache County, Day 1, skull. Jane Doe R and 17 Saguache County, Day 2 and 3. The 3 bags contain multiple human and non-human bones and fragments, dirt, and a wood fragment. The submitted human bones include the skull with mandible, sacrum, multiple ribs, bilateral radii and ulnae, manubrium and sternum, right scapula, clavicle, right and left femora, right and left tibia and fibulae, and multiple vertebrae. None of the bones bear any residual soft tissue. The right femoral head, femur fragment, and femur head is retained for toxicology testing prior to release for forensic anthropology examination. Let's stop there, and what we're going to do is review the bones that were retrieved and the ones that were not retrieved. And to do that, I have a diagram. Here is a diagram of the skeletal system, and you can see that the small red dots with what looks like a bullseye, those bones were listed in this document as received. The circle that has the lighter color red, the more transparent color red, those bones were missing. So starting at the top, you can see that the skull was retrieved and the lower jaw or mandible. They didn't specifically mention the facial bones or the maxilla. I'm guessing there was damage, and the zygomatic arch in particular is pretty thin and fragile. So, in the nasal bones. So I'm imagining there had to have been some amount of damage to them. But I guess that they were probably present. However, they did specifically mention they received the mandible, perhaps because that is like a joint connected to the skull by a joint, and that's why they mentioned it. They mentioned they had a few vertebrae. They didn't mention how many. So that's the backbone, the one that runs from the neck all the way down to the pelvis or the hips. If we go back up to the neck area, you'll see on the left side is the dot that says collarbone or clavicle. There's 2 dots there. The other one is on the scapula or the shoulder blade. Both of those on the right side were retrieved, but the ones from the left were not retrieved. So you can see the difference there. The ones on the person's left or on our right are the transparent circles, meaning those bones were not listed in the autopsy report. In the center, under the neck, moving downward in the center of the rib cage, you'll see 2 dots. That's the manubrium and the sternum. The manubrium is the small piece at the top. The sternum is the larger at the bottom. It's a larger 2/3 or so of that chest bone. Those were noted as being present. They mentioned some rib bones or multiple rib bones. However, they didn't say how many or which ones. So I've just indicated here that, some are missing, some are there. I don't really know. They weren't clear on that. The humerus or the upper arm bones were not listed in being bones that were received. I always remember the humerus because the humerus ends at, if you hit your elbow and you get, they say it's your funny bone, it feels weird. That's right there at the humerus. And the funny bone, I suppose, might be considered humerus. That's how I remember that. But neither of the humerus were noted as being collected. So those seem to be missing. However, the bones just distal to that, and when I say proximal and distal, proximal means closer to the trunk. Distal means further away from the trunk. So if you imagine the skeleton raising his arms up so they're extended out like in a T pattern, distal would be the fingertips, proximal would be like the biceps. All right, so if we go down distal on those arms, both of the arms of the forearms, the radius and ulna, both of those were present, and each arm, both of them were present. So, and all 4 bones from the forearms were retrieved. There was no mention of any of the hand or wrist bones or finger bones or feet or toe or ankle bones, meaning tarsals and carpals, metacarpals, phalanges. None of those were listed as having been found or been retrieved with the remains. Let's go back to the center of the body, back to the hip area, and you'll see right in the center of the hip, that is the, it's the sacrum, but if you kind of follow the arrow up to the right, upper right of the screen, you'll see a larger picture of the pelvis and the sacrum, and the sacrum is in red, the pelvis is in white. So as far as what I could tell by the autopsy report, neither pelvis bone was found, but the sacrum was retrieved. Moving on down to the femurs, both femurs were retrieved. Neither patella or kneecap was mentioned as having been retrieved. However, if there were fragments, those may be difficult to identify depending on how small the fragments were and the experience of the pathologist. Further down or distal yet there are the shin bones. So you have in your calf, that's the fibula bone, and the shin bone, the one in the front, that's your tibia. So the tibia and the fibula of both legs were listed as having been retrieved in the remains. I hope that's a helpful illustration. I do want to mention one more thing. They said that there was a medical device that was discovered, or that was also found at the scene when they were listing the clothing, etc. And they said it was a purple medical device, and this is what they found. This is called a portacath, and this is inserted in the body, and if you notice that what looks like a plunger type thing in the very center, it's a circle, that's where the needle enters, and it clicks into place in the back to a little piece of metal there, and then you can infuse the medicine and or fluids or blood, whatever it is the person would need infused, antibiotics, etc. And it just travels down that purple cord or tubing into the vessels of the person. And you can see that it's placed on the left upper chest. Usually just 1 or 2 small incisions are made. It's tunneled in there, and there's no muscle or anything kind of overlaying it. So when you put that needle in and it goes into that plunger looking thing is literally pressed up against the skin there. And so people who are getting frequent transfusions, blood, lab tests, you can get what's called a port, which is what this is. And you don't have to get an IV placed every time or get your vein poked every time in your arm for blood draws, etc. They can do the blood draws and everything right out of that port. There comes a risk of a serious and fatal infections from that every single time it's accessed. There's a risk for a fatal infection. So it's not something that everyone should just get, just for their annual blood draws. But this is what's used in a lot of cancer patients or patients with other specific chronic illnesses where they need frequent infusions. I just wanted to show you that. Okay, so we're back to the autopsy report. Submitted is an envelope labeled 92423 HLS-11 2023-404 purple medical device grave. The envelope contains a dirt-covered purple medical port labeled 6328. Each one of those medical ports has a serial number, just FYI, and apparently the serial number on that portacath was 6328. That can be traced back to the individual patient. It's registered when the hospital places that on the individual. 7 brown paper bags remain in the custody of CBI, which is the Colorado Bureau of Investigation, and contain a pale pattern balaclava, a pink and light color leather work glove, a light color partial padded bra, a ripped dark blue-gray hooded sweatshirt labeled Crested Butte, a torn green Nike tank top, Yeti shorts, and a fabric fragment. The clothing and fabric fragment are all weathered and covered in dirt. All paper bags were labeled respective to their contents. 6 envelopes remain in the custody of CBI, contain 5 fabric fragments and 1 weathered bullet, and are labeled as such. Evidence. The medical device is released to Chaffee County Sheriff's Office on 9/27/2023. A disc of 2 X-rays is released to Dr. Kim Look on 9/28/2023. TA-11 possible bones and TA-12 bones are received on 9/29/2023 from CBI to be included with the collection of skeletal remains subsequently released to Dr. Diane France. After receipt of the remains back to El Paso County Coroner's Office, these packages appear to have contained probable rocks. 3 teeth are released to CBI on 10/23/2023 for DNA testing. The skeletal remains are released to Dr. Diane France for forensic anthropology examination on 10/3/2023 and returned to El Paso County Coroner's Office on 12/27/2023. 1 paper bag containing 4 packets botany bug and 2 packets from Hoodie are received on 1/16/2024 from Diane France. On January 17, 2024, the femurs are sectioned at the proximal and distal metaphyses for toxicology, and DNA samples right femur proximal, right femur distal, left femur proximal, left femur distal. Distal femurs, right femur distal, and left femur distal are released to CBI on 1/22/2024 for DNA testing, returned to El Paso County Coroner's Office on April 3, 2024, and re-released to CBI on April 5, 2024. That is the end of the report. And let me remove this. This is Barry Morphew. This is his most recent booking photo for 6/20/2025. We're praying for justice for Suzanne Morphew. And now, the Autopsy Knowledge Bank. We are going to just review antemortem versus postmortem injuries. This is just a one-page thing that I'll try to kind of put something in at the end of every autopsy report we do, and hopefully kind of brief but interesting. All right. This was an article that was reprinted from encyclopedia.com, which is pretty basic, but I thought they did an excellent job describing things. Antemortem injuries are those injuries a body has received before death. Antemortem is before death. They may be a contributing factor in the death or even its cause. On the other hand, they may have occurred many years ago. During an autopsy, the pathologist assesses the age of the antemortem injuries as well as distinguishing them from postmortem injuries, that is, injuries occurring after death. Postmortem injury can come from various sources, such as deliberate mutilation of a body by a murderer following a homicide, predation by wild animals, or careless handling in the mortuary. Post-mortem injuries can cause confusion over the manner and cause of death. And that is because if you're uncertain of what caused the death or what happened, and there's a bunch of injuries on the person, and they were antemortem or perimortem right around the time of death, you could have a difficult time figuring out exactly what happened in what order. One major difference between an antemortem and a postmortem injury is the presence of signs of bleeding. While the person is still alive, the blood is circulating, and any injuries, such as cuts or stabs, will bleed. After death, the body usually does not bleed. However, there are exceptions. For instance, when a person drowns, their body usually floats face down, and this results in the head becoming congested with blood. If the cadaver received a head injury by being buffeted around in the water and colliding with boats' propellers, then there could be some evidence of bleeding. Scalp wounds sustained after death may also leak some blood. It can be especially difficult to distinguish between injuries inflicted in the very last few minutes of life and those caused post-mortem, meaning perimortem, the last few moments of life, perimortem. If the person collapses, there may be areas of laceration, cuts or scrapes to the head and scalp, which may be hard to interpret. So say the person collapses from a heart attack, but then, the EMS arrives and it looks like he got hit in the head really hard. Well, did that happen after he collapsed, or did he collapse because of that, is what they're discussing here. After death, the blood stays liquid in the vessels and no longer clots. Careless handling of a cadaver may produce some post-mortem bruising, which may need to be distinguished from ante-mortem bruising. Blood also tends to pool under gravity after death, causing a bruised appearance in the lower limbs, arms, hands, and feet, known as lividity. Also, lividity can be seen on the back if the person's lying on their back. So anywhere that is at the very bottom of the body, depending on their position, that's where it's going to be. Some of the smaller vessels may even hemorrhage under the pressure of the pooled blood. These bruises could be confused with ante-mortem bruising. Recent research has focused on improved techniques for distinguishing between an ante-mortem and post-mortem injury by analyzing damaged tissue microscopically. Ante-mortem injuries show signs of inflammation, which means swelling. If you get a conk on the head, it's going to swell up. If you're alive, if the injury is before death. And a post-mortem injury, let's see, by analyzing damaged tissue. Ante-mortem injuries show signs of inflammation, while post-mortem injuries do not. Chinese scientists have found that tissues from ante-mortem injuries contains a chemical involved in inflammation, which is leukotriene B4, LTB4 for short. Post-mortem injuries were found to have no LTB4. This could help the pathologist classify injuries more accurately. So, leukotrienes are chemicals that are released by your immune cells, your white blood cells. And so in order for the leukotrienes to have reacted and to travel to the site, that means the person would have had to have been alive, because there's no blood circulation after death. So that's a really interesting thing that they've done there, and a way of discerning whether an injury was caused by, or whether an injury was before or after the death of the individual. Just want to say thank you all for being here. I hope you enjoyed this. I'd love to hear your thoughts in the comments. And if you have any autopsy reports you'd like me to review, or if there's anything different you'd like me to do, any way you would have liked me to kind of done this differently, maybe you couldn't see the slides, that kind of thing, please let me know. It was great chatting with you all. See you all soon. Bye-bye.